and I'm going to be going over common depression screening tools in pediatrics. First, I'd like to go over just some things about depression. According to the CDC, an estimated 4.4% of American children and adolescents have been diagnosed with depression. While depression was long seen as an adult problem, researchers now know that even a 2-year-old child can experience depression. So what is depression? Depression is a common but serious mood disorder. Some symptoms can be feeling sad or hopeless, irritable, showing changes in eating patterns, eating too much or eating not enough. Some parents will report that they've been having difficulty sleeping or they're sleeping all day long, low energy and fatigue, that they haven't been as active as they used to be. Often they'll have problems paying attention in school. They have feelings of worthlessness, uselessness. They may have self-harm behaviors or self-destructive behaviors as well. Another thing that you would want to know is when to start screening for depression. So, according to the American Academy of Child and Adolescent Psychiatry, we should routinely screen for depression in children and adolescents age 8 and older across primary care settings. We should assess for symptoms of depression in children and adolescents 3 and older when referred for emotional or behavioral problems. If a child does have depressive symptoms, then we should conduct a clinical interview with the parent and the child to assess for a possible diagnosis for depression, but we can refer them out also to behavioral health or psychiatry. Once the diagnosis of depression has been established, they should be educated about what depression is and get treatment. It's important that we try to aim to improve education for health professionals and teachers and the general public about signs and symptoms to look for in depression and the treatment for youth, as this is often, the children are often missed in this category. So what can you do as a health care provider? You can evaluate and manage suicide and self-risk harm in the primary care setting. And what that means is we can assess for the risk, we can build hope and reasons for living, we can connect them with positive role models or even like services. If they're not safe, we could call a social worker as well, just making sure that they have positive people in their lives. We can develop a safety plan with them, also teach them about different coping mechanisms when they do feel like they're getting anxious or depressed. Screening tools, risk stratification protocols, and clinical pathways have been developed to support primary care evaluation and management of suicide and self-harm risk. Traumatic stress is associated with an increased risk of suicidal and self-harm behavior, underscoring the need of a trauma-informed approach. And this is important because children often have triggers that we're unaware of, so it's important to just have a really therapeutic approach and really try to educate ourselves or even like ask questions that might let us know that they've experienced some kind of trauma. Every practice and clinic is different, so your approach will be developed. So I think this is important because whatever screening tool you use, that you just want to use it consistently, or even find one that seems to best work within your practice. And I think that as we speak to our preceptors and we get experience in the clinic, we'll kind of find what kind of screening tools we'll use, but I'll be going over some of the common ones. So just to understand a little bit about depression. So depression is it's an illness, and it's not seen, and it's difficult to assess in children. So often they'll feel lost. They'll feel guilty. They won't understand that, other people might experience this too. They feel alone. So coming from just a open view and also an alert, being alert and able to discern whether this child might have depression is very important. For ages 10 to 24, suicide is among one of the leading causes of death. I think it was like the second cause of death. They said it is a serious public health problem. So screening should be done often and at every well-child visit. Anytime you suspect that the child might need a depression screening. So in 2021, according to the CDC, there were 48,183 suicides. I felt like this was important because it's often missed amongst children. Males do commit suicide more often, about almost 80%, and females at 20%. However, even recently, it has shown, the CDC vital statistics system has shown that about 4% of there was an increase in females, about 4%. In individuals aged 1 through 19, the CDC reported that for every one completed suicide in adolescence, there may be as many as 25 suicidal attempts that occur. So what can we do as health clinicians to decrease depression or decrease suicidal ideation? So one of the things I found in my reading was that social media was linked to higher rates of suicide amongst children and young adults. So, talking about limiting phone use, limiting social media use is important at your well-child checks. Also, healthy eating, as junk food has been linked to greater rates of depression. Speaking with the parents regarding behavior at school, poor school performance, and then maybe possible like mood disorders or mood concerns, and then evaluating our patients and referring them out as we need to is important as well. Making sure they get connected to the right services. Another one is staying active. So we want to encourage these patients to be active, to get outdoors, to perhaps participate in recreational sports, because sedentary lifestyles have been linked to mood disorders and self-reported depression as well. So the screening tools that we're going to be going over are the PHQ-9 modified for teens. The screening tool is used for children 12 to 18 years old. And then there's another one for adults as well that you'll see perhaps in your practice. The other ones are the HEADS assessment and this screening tool. It screens for different things like homelessness, also drug abuse, and sexual practices and stuff like that. But it does also screen for suicidality and depression. And this screen tool, you can start using it for your pediatric patients around 10 or 11 years old. And then this is also dependent on like if they have other risk factors, or maybe the mom comes in and says, I think that he's been really depressed. He hasn't been taking care of himself, and he doesn't want to hang out with his friends anymore. He spends a lot of time sleeping, and I'm not doing any activities. Maybe a traumatic event happened. Maybe there was a death in the family. Those kind of things, you might want to screen them a little bit earlier than the 10 years old. The other one I want to go over was the Edinburgh Postnatal Depression Scale. This one isn't given to our pediatric patients, but it's given to our new moms. So our new moms should be screened at the well-child visits when they're bringing in their baby at the 1 month, 2 month, 4 month, and 6 month visits. It should be done at least twice, according to the American Academy of Pediatrics. But as much as we can, we should make sure that we're screening their moms for postpartum depression, as it's a risk for safety for the infant. So this is the PHQ-9 modified for teens. It screens for, like I said, depression, Usually with the adults, there's like 2 questions that we ask, and then we just expand from there. But if you see on like the right side, it'll tell you like the severity of the depression, and then based on what they say, you might want to give them a psychiatric referral or behavioral health referral, or you may need to call like a crisis stabilization unit to come evaluate your patient for suicidal risk, because they may need to be put on a hold depending on how they answer. This one is the heads interview, and there's just some examples of questions that you would ask to assess them for the homelessness or education, food insecurity, drug use. But if you look on like the suicide and depression, so there's like the first questions of have you thought a lot about hurting yourself or someone else? And then if you think that the patient is depressed, you might want to try like also asking some of the secondary questions on the right side. And those are like, have you ever tried to kill yourself? Do you find yourself spending less time with your friends? Have you used drugs and alcohol? Because these things can be factors that might increase their risk for suicide. And then the last one that I wanted to discuss was the Edinburgh postnatal depression screening. So, like I said, this one is given to the mom, and she's going to answer the questions. There's like 10 questions, but she's going to answer them based on the past 7 days. And so, if she was to screen that you were to screen her, and she was having high scores, showing that she may be depressed, then this is when you'd want to refer out to a behavioral health specialist, and possibly call a social worker, or refer her out because of the safety of her and for the baby. These are my references. There's a lot of good links. I would recommend looking at the American Academy of Pediatrics because they have a lot of resources regarding screening tools for not only depression but other mood disorders for children. Thank you very much, and have a wonderful day.